Welcome. Today we're going to look at another body system that's the result of most of the calls that you're going to go on as an EMS provider. And that's the cardiovascular system. So let's break away the body here and take a look at the meat of the cardiovascular system, or the heart. And we're going to focus mainly on that in this short video and look at the anatomy and how it interacts with the rest of the body. So we can see the heart here. Let's take a closer look. And as most of us know, the heart is what generates the pressure to push blood throughout the body. It's a very powerful organ surrounded by muscle. Inside the muscle, though, are individual chambers or holes that blood passes from one to the other. And it's the order that blood goes through these different chambers that can create many problems with our patients. So before we can understand the problems, let's break apart these individual chambers and look at the path blood takes from one side to the other so that we can better understand what's going on with our patients based on their complaints. So a better place to start than from the very beginning. And as you see here, you have several thick blue lines which represent the deoxygenated blood inside veins that all come together into one section of the heart, and this is the right atrium. And you can see a good picture of the right atrium right here. The right atrium is a small section of the heart under very little pressure, and this is what all the deoxygenated blood eventually ends up right here in the right atrium. So blood flows into here from the vena cava, that big blue line we saw before, and when the heart muscle pushes, or when the heart contracts, blood is forced from the right atrium through a valve into the right ventricle. Now we cut away the muscle here, and you can see the valve right there in the middle of your picture. And this is the tricuspid valve. The tricuspid valve prevents blood from backflowing. So as blood comes into the right ventricle, that valve will close and prevent blood from going backwards and back up into the right atrium. So now we have the blood sitting here in the right ventricle. And again, we have the muscle, and as the muscle contracts, our next heartbeat, blood is forced into the next part of the heart, which in all actuality isn't part of the heart at all. The blood's going to leave the heart through this valve right here. This is the pulmonary valve, which is the beginning of the pulmonary blood flow, the pulmonary trunk. This valve prevents blood from coming back into the right ventricle, and as you see here is the very beginning of the pulmonary trunk, or pulmonary artery. The pulmonary arteries take the blood from the right ventricle, or the right side of the heart, and into the lungs, where it picks up oxygen. We're going to zoom out here just a little bit, and you can see the pulmonary circulation right here, the network of at this point, arteries that take that deoxygenated blood, go to the lungs, pick up some oxygen, and then return to the heart through pulmonary veins. Remember, arteries go away from the heart, veins return to the heart. So we go to the lungs, we pick up some oxygen, and now it starts to flow back to the heart, and we're going to start on the left side of the heart now. So blood's gone through the right side of the heart, left the heart. Now it's coming back. Right here is the pulmonary vein, and you can see if we twist the heart just a little bit, the left atrium is kind of hidden here, but there it is right there. That's the left atrium. And the left atrium, like the right atrium, collects blood coming back to the heart. Now though, this blood is full of oxygen. We just picked it up from the lungs. So here's another shot of the left atrium, and we're going to turn the heart around here, because at the next heartbeat the blood's going to leave the left atrium and move to the left ventricle. And here's the muscular side of the left ventricle here. So cut away the muscle again, and like the right side of the heart, we have another valve. This is the bicuspid valve, and this valve, like the other, is designed to prevent blood from backflowing into the left atrium. So there's your bicuspid valve, and we're looking at the left ventricle. Blood flows through there, collects in this fourth chamber, and then waits for the next contraction. This is the powerful one, the one that pushes it through the whole body. Muscle contracts, and the blood flows upward, and we're going to move just a little bit here so we can see the aortic valve, and you can see it right there at the top of your screen. That's the aortic valve. It's kind of hidden slightly, but there it is. That's the aortic valve, and that protects blood from backflowing once it enters the aorta. So we're going to zoom out and twist a little bit, and we'll be able to see the aortic arch. Now we're done with the heart. blood has circulated all four different chambers. It's gone to the lungs, it's picked up oxygen, and there's your aortic arch right there. And branching off of the aorta are several major arteries, one that goes up towards your head and the others that go to your heart, and we'll talk about those in another video cast here shortly. But there it is, twists around the back of your body, and now you'll notice that the lines are red. This is very oxygenated blood under a lot of pressure, and we're going to zoom out again, look at the full body, and there's the aorta stretching down. And if we take a full body shot, you can see that that aorta branches off into all of your major arteries, and we enter the arterial circulation side. All of the red lines are oxygenated blood. We start with arteries. We go to smaller arteries called arterioles. Those break down to very small vessels called capillaries, where oxygen leaves and goes into the tissues, and then we start the blue side all over again as we offload all that oxygen. We start it all over again. Thank you for watching.